We all want great healthcare, and like most places, we're getting a little older as a population, and demands on services are growing. With lots of different parts of the NHS system, from GP practice to urgent care centres and hospitals, we're aiming for everyone to work together to provide high-quality care for patients. It's part of the NHS 5-year plan. That means each organisation providing care to the local community is pooling resources to support the joint commissioning of health and social care for everyone, so that all patients, especially the vulnerable and the chronically ill, get the right care at the right time that's increasingly harm-free. In essence, we want to shift the focus of our aims away from illness towards wellness, with the way we plan care moving forward being based on all of us staying fit and healthy, instead of only fixing things when we get ill. It also means, as patients, we get more involved in our own healthcare. Each one of us is part of a team, and ensuring the community's well-being is our collective responsibility. That might mean doing a bit more exercise, eating home-cooked food, or giving up smoking. Funnily enough, even being more sociable helps our mental health, which is so important. We'll also focus more on prevention, which means taking steps before we get ill, like avoiding falls, and having MOTs when doctors recommend them. It's useful to think about car maintenance when talking about health. We need to maintain the machine, just as we do our bodies. When we've clocked up a few miles, parts often need a bit of attention, like getting a new tyre when the tread wears down. And like food, it's best to use good quality fuel, but for some cars, the unleaded sugar-free fuel is essential. Of course, there are still NHS care professionals to provide high-quality care in a planned way when anything does go wrong, just like we've always had. That includes supporting patients to stay well and services being more convenient and efficient, so we get our windscreen repaired when it cracks, as well as servicing the engine to keep it firing on all cylinders. To help bring everyone together, we'll develop health campuses in each neighbourhood to deliver a range of services to help meet the needs of the local population. This makes the system less complicated, less fragmented, and reduces hospital delays. Getting referred when we need to be should be more straightforward too, as everyone who needs to work together on a patient are part of the same team, using the same system. Ultimately, we're making these changes because we want to improve everyone's well-being. That means making NHS services more integrated so that the physical, social, and mental health needs of each person are met. And patient-centred, based on good relationships between everyone on the same team, including the patient, as well as coordinated and accessible. And, of course, we want care to be high quality and safe to help keep each of us in the best possible health. Underpinning all this will be good use of technology to support an experienced, well-equipped and dedicated NHS workforce. We can only achieve these things if we work together as a team. We want to build on the excellent work already being done and ensure each one of us feels well, stays well from the beginning to the end of life.